Homeless shelter providers were in Augusta today pleading with lawmakers to support two bills that would help provide funding for the next couple of years. They say if they don't get this funding, they will have to lay people off and start closing their shelters. News Center Maine's Jack Mulmond was there today and has more details from the Capitol.
Well, this really is a tale of two separate crises involving low-barrier homeless shelters. The first being the increasing number of unsheltered people in the state of Maine. The second involves the end of pandemic relief funds, which were once used to fund these low-barrier homeless shelters. Tuesday afternoon in the State House, a dire warning.
This is important.
That there just isn't enough money to fund the state's homeless shelters that help those who need it the most.
The pandemic really masked over some systemic issues.
Dr. Katie Spencer-White is with the Mid-Maine Homeless Shelter in Waterville. She says low-barrier homeless shelters around Maine are operating at a deficit of collectively millions of dollars.
This time next year, we will literally have hundreds of unsheltered people living in tents in Maine.
And if these low-barrier shelters don't get funded this year, providers speaking in Augusta today say they will shut down and start laying people off. But what is a low-barrier shelter?
We are the place they can come, not only for a bed, but for wraparound services, navigation support, peer navigators.
Lori Dwyer with Penobscot Community Healthcare says it's for people who have nowhere else to go. People you think of when you hear the term chronically homeless.
It was a very difficult decision.
But now Dwyer says her shelter, Hope House in Bangor, is set to shut down by the end of the year if this funding doesn't come through.
It is critical. It may be small, but it's a critical piece that's going to keep the existing shelters open.
The goal is to avoid the crisis this year through a bill to fund low-barrier shelters.
There's an overdose crisis. There's a substance use disorder crisis. This is the first line of defense.
Representative Colleen Madigan of Waterville and Winslow. She has a good feeling, carrying the legacy and inspiration of why she does this work in the State House.
2 years ago, my sister died of alcohol withdrawal. The only difference between her and someone who needs low-barrier shelter services is she had a home in my home. But if it wasn't for that, she would have needed these services.
This News Center Maine's Jack Mulmond reporting. Now, the bill to fund low-barrier homeless shelters will need to go through a work session at the State House in the coming weeks, but the goal is to bring some version of it to the governor's desk. We asked Governor Mills' office if they are on board with more funding for shelters, and they sent us a statement that says, in part, quote, "The administration is reviewing this issue as we work on the supplemental budget proposal, while also encouraging our partners to seek additional avenues of support that, together, could create a solution."